So we're here today to talk about the Suffolk County Health Department's opioid overdose prevention program. Narcan has been around for decades. It was limited to use by doctors, by nurses, and by others in hospitals, as well as by paramedics in an ambulance service who were trained in IV administration and giving a dose intravenously. So now with the advent of Narcan administration by inhalation through a device called a mucosal atomizer device, we can now effectively insert this device into a nose and squirt Narcan into the nose. It gets absorbed by the blood vessels and it gets into the system almost as fast as if we were to give it intravenously. So because we've taken the needle away, just about anybody can be trained to administer Narcan. While we typically focus on opioid overdose in the illicit drug world, we also encounter other overdoses. For example, children who are curious and are crawling around who may inadvertently get into somebody's medications by accident. Elderly people who may have chronic pain, who are on opioids for pain management, who may accidentally overdose by taking pills or putting patches on where they may forget they're wearing it already. We have receptor sites throughout our body that control the vegetative functions, the things that we don't have to think about every day: breathing, heart rate, pupillary dilation and response. When someone ingests too much opioid, is that the opioid actually binds to these receptor sites, and when the neurotransmitter that says breathe gets to the receptor site, it hits a brick wall and it can't do its job. So as a result of that, the breathing rate continues to steadily decline. Giving Narcan is the antidote, and much like you could envision a crowbar, literally pries the opioid off the receptor site, allowing the normal neurotransmitter to work, and the body will miraculously start to breathe again. The one thing that makes Narcan so successful is that if there is no opioid in the body and Narcan is administered, it has no other effect on the body whatsoever. Despite the widespread popularity of Narcan, it is still technically a prescribed medication. And so when you take our training, you walk away with a certification card signed by our physician authorizing you to possess and administer this medication. All you need to do is present to us with an interest, and we don't care what your motivation is. You may be a substance abuser, you may be the family of a substance abuser, you may be in a capacity to come across somebody who's overdosing, and we don't care, we don't ask, it does not matter. And within this blue bag are 2 doses of Narcan, some gloves and some mucosal atomizer devices, a couple of data sheets and some other things at no cost to you. As soon as we determine that somebody appears to be unresponsive and we believe that they're suffering from an overdose for any number of reasons, we immediately call 911. So we observe slow, shallow respirations. We try to do a very aggressive sternal rub to see if they respond to that painful stimuli. We open up the eyelids and look at the pupils. You will see, if it's an opioid, 2 very small pupils. And then we're also observing around the nose, the lips, the underneath of the eyelid, and perhaps the fingers for a bluish tinge called cyanosis. It comes in 2 pieces. We have a plastic shooter and we have a glass vial that contains the medication. Notice you have 2 round caps and 1 oblong cap. So taking the 2 round caps off, we're going to very simply insert the glass into the plastic and turn it until it stops turning, and that's locked in. We take the oblong cap off and we affix our mucosal atomizer device by very simply touching plastic to plastic and turning until it stops. And because we are going to touch a person's nose, we do have gloves in the kit for your protection. Open up the nostrils to make them as wide as possible. Take our cone-shaped mucosal atomizer device and stick it into the nostril until it doesn't fit anymore. And we would observe our graduations on the syringe to follow our dosing, which is 1 milliliter or half the syringe in one nostril, followed by the remaining milliliter in the other nostril. The patient will start to spontaneously breathe. We advise our lay people to instruct the patient to sit down, to relax, to expect that they're going to be feeling a little bit ill, and hopefully by this time 911 is on the scene and we let the professionals take over.